The sternocleidomastoid muscle, this is the insertion, is the mastoid process of the temporal bone, and the origins are the clavicle and the sternum. Next, we have the trapezius. The origins are the external occipital protuberance and the superior neutral line. Here, both these. And the insertion is the clavicle and the scapula. The occipital muscle, the occipital belly of the epicranius muscle, these are the origins, is the occipital bone and the mastoid process, and then the insertion is the epicranial aponeurosis. In the frontal belly, the origin is the epicranial aponeurosis, and the insertion is the skin of the eyebrow and the root of the nose. Right there. So the orbicularis oculi is this muscle right here. The origin is the orbital rim, nasal process of the frontal bone, and the frontal process of the maxilla, and then the insertions are the lateral eye regions right there. This is the corrugator supercilii. The origin is on the frontal bone in the supraorbital region, and then the insertion is at the eyebrow. So this muscle is the orbicularis oris. It goes also on the mandible. The origin is just encircling the mouth. So we have here and here, goes all the way around the mouth, and then the insertion is the commissure and the philtrum, which is right here. So this muscle right here is the buccinator, and the origin is the alveolar process of the maxilla and mandible, which is over here, and the pterygomandibular raphe, which is back here. And then the insertion is the commissure, which is right here. So the risorius muscle, this is the origin, it is the masseter, and then the insertion is the commissure over here. So this muscle is the levator labii superioris, and the origin is the infraorbital rim of the maxilla right here, and the insertion is the upper lip. So this is the levator labii superioris allocanesi, and the origin is the frontal process of the maxilla, and then the insertion is the ala of the nose and the upper lip. So this muscle is the zygomaticus major, and the origin is the zygomatic bone, and the insertion is at the commissure. This one's the zygomaticus minor, the origin's at the zygomatic bone, and the insertion is at the upper lip. This one's the levator anguli oris, and the origin is at the canine fossa, and the insertion is at the commissure. So this muscle is the depressor anguli oris. The origin is the lower border of the mandible, and the insertion is at the commissure. And this muscle is the depressor labii inferioris. The origin is the lower border of the mandible, and the insertion is the lower lip. This is the mentalis muscle. The origin is the mandible midline, and the insertion is the chin. This is the platysma muscle. This is the insertion, the lower border of the mandible, and then also the muscle around the mouth. And the origin is the connective tissue covering the chest muscles. This is the masseter muscle, and the origin is the zygomatic arch, and the insertion is the mandible outer surface right there. This is the temporal muscle right here, or the temporalis, and the origin is the temporal fossa, and the insertion is the coronoid process of the mandible on the inner surface. This muscle is the medial pterygoid. The origin is the lateral pterygoid plate, and then the insertion is the angle of the mandible. This muscle is the lateral pterygoid. The origin is the greater wing of the sphenoid in the lateral pterygoid, and the insertion is here, the pterygoid fovea and the TMJ capsule. So for the digastric muscle, the anterior belly, this is the origin at the intermediate tendon on the hyoid, and then for the insertion of the anterior belly. It is the symphysis on the mandible. So the origin of the posterior belly is the mastoid notch, and the insertion of the posterior belly is the intermediate tendon on the hyoid. So for the mylohyoid, the insertion or the origin is the mylohyoid line, and the insertion is on the hyoid. So the styloid hyoid muscle, the origin is the styloid process, and the insertion is the hyoid. So for the geniohyoid muscle, the origin is the genial tubercles, and the insertion is at the hyoid. So this is the sternothyroid muscle right here. The origin is at the sternum, and the insertion's at the thyroid cartilage right up here. This muscle right here is the sternohyoid. The origin is down here at the sternum, and the insertion's up at the hyoid. This muscle is the omohyoid. The inferior belly, so the origin of the inferior belly is down here at the scapula, and then the insertion of the inferior belly is at the superior belly. So for the superior belly, the origin is right here at the inferior belly of the omohyoid muscle, and then the insertion is up at the hyoid. So this right here is the thyrohyoid muscle, and the origin is at the thyroid cartilage, and the insertion's up at the hyoid. So next is the genioglossus, and the origin is right here at the genial tubercles right here, and then the insertion is at the tongue, base to the apex, and the hyoid right here on the hyoid. So for the styloglossus, the origin is the styloid process, and the insertion is the lateral surface of the tongue from the base to the apex. For the stylopharyngeus muscle, the origin is the styloid process, and then the insertion is not labeled, but it's the lateral and posterior pharyngeal wall. So for the superior pharyngeal constrictor, the origin is the hamulus in the mandible, and the pterygomandibular raphe, and then the insertion is the median pharyngeal raphe. So for the median or the middle pharyngeal constrictor, the origin is the hyoid bone, and the insertion is the median pharyngeal raphe. For the inferior pharyngeal constrictor, the origin is at the thyroid and cricoid cartilage, and the insertion is at the median pharyngeal raphe. So for the palatoglossus muscle, the origin is the median palatine raphe, and the insertion is the tongue. For the palatopharyngeus, the origin is the soft palate, and the insertion is not labeled, but it's the laryngopharynx and thyroid cartilage. For the levator veli palatini, the origin is the temporal bone on the inner surface and the median palatine raphe. For the tensor veli palatini, the origin is the sphenoid bone, and so is the insertion. For the muscle of the uvula, the origin is the posterior nasal spine, and the insertion is the uvula. For the pterygomandibular raphe, it runs from the hamulus all the way down to the mylohyoid line. For the median pharyngeal raphe, it runs from the pharyngeal tubercle all the way to the posterior wall of the esophagus near the C6 vertebrae. The median palatine raphe runs from the uvula all the way to the incisive papilla. And here is the intermediate tendon. So this right here is the TMJ capsule. Right here is the TMJ ligament. It runs to here, which is the articular eminence all the way to capsule. So for the sphenomandibular ligament, it runs from the spine of the sphenoid bone all the way to the lingula of the mandibular foramen, which is right there. For the stylomandibular ligament, it runs from the styloid process to the angle of the mandible